Hello friends, exactly 9 years ago, in the year 2017, we performed a breast lift surgery on our patient, and today is the ninth year checkup. Our patient is extremely satisfied because the breasts are incredibly successful. Even after 9 years, seeing the breast in this form made me really happy. Normally, over time, we age and our skin loosens. However, despite that, your tissues are so nice that they haven't sagged much. I would have thought it would have sagged more. Truly, it's extremely beautiful.
Look, the upper pole fullness is quite good, and in this patient we did not use silicone. It's a breast form made only with her own tissues.
Where were your breasts before? Were they around here in terms
Honestly,
of
I don't
sagging?
fully remember about the sagging. It was quite low, I mean.
It was quite low,
Yes.
wasn't it? It was a very saggy breast. It seemed like it was emptied. Actually, here I used your own tissues to fill out the upper pole.
Of course, I also use silicone for some patients. For example, I used silicone for the previous patient. They have a fuller upper pole. However, after a certain age, there are some drawbacks like needing to replace or remove it. So I don't say let's use silicone for every patient. Besides, it means your tissues were sufficient, so we did it. If the tissue was insufficient, we would have had to use silicone.
So how have these 9 years passed for you during this period in terms of the process? Did you have any pain, aches,
No,
or
never.
problems?
No.
Your work activities, sports.
Nothing stopped me. I mean, I'm doing everything. I was working. I mean,
Yes.
I'm also doing my exercise. Nothing.
Comfortably. Our scars turned out great. Your wonderful healing. Really, almost no scars. Has anyone seen your breasts, like your friends? What do they say about those stitch marks, their appearance?
Honestly, no one said anything.
You say no one looks at that eye. I guess that's how it is. Maybe they don't even know you had surgery.
No, I showed it to my close friends and family. By family, I mean my sister and my sister's-in-law. I didn't show it to anyone else.
You even say that, no, Jade. I understand, sir. Okay.
Now, we will move to your abdomen, friends, because our patient has quite a few stretch marks on the abdomen. I think a plan should be made for these stretch marks in the future. I will do some Botox on our patient's face shortly, but a lift is definitely needed for your face, especially because your nasolabial folds are down and your eyebrows are a bit low. Perhaps even a classic facelift could be planned. Even if the swelling here doesn't completely go away, it will reduce, let me tell you that. Let me also point out that it will decrease, because these have really become the most noticeable areas on your face. Let's plan for that inside shortly.
Let's see.
All right, sir. Thank you. Thank you, sir.